Aloha, and thank you. I asked Virginia if I could be optional because I have learned my lesson after being a nurse and talking about sexuality. If people aren't ready to hear it or they don't want to hear it, then I feel uncomfortable and I can't talk openly with you. So you'll see that the topic says exploring intimacy and sexuality, but the real title, this is what it's really about, a candid conversation about sex. What's happening for men and women before, during, and after. And that's what we're going to talk about. So I'm an old Army nurse, and I still work at Tripler. You cannot blame Tripler for it, but I always have to put a disclaimer slide in. And I also want you to know my parents from Ohio did everything they could to raise me to be a good daughter. But I'm a nurse. And if your arm hurts, I'm going to ask you about your arm. I'm going to ask you about your leg. I'm going to ask you about your bowel movements, if it's a floater or sinker, if it's a one flusher or two flusher. And I'm going to ask you about your penis or vagina, because it doesn't do any good if I talk about down there or you know. Right? Okay, good. I'm glad you warned him I'm a little humorous. Okay, so sexuality. It's often not discussed. And I have found that it's very important. Here's why. As an oncology nurse, I had a 16-year-old boy who had testicular cancer. He came in with gonorrhea. Why? Because he had had an orchiectomy. They had removed one testicle. All the girls at school wanted to have sex with him because they felt they couldn't get pregnant. Right? And when you're 16, you worry about pregnancy. You don't worry about STDs. And as a nurse, I was so interested in getting him through chemotherapy and body image changes because he was going to gym class. And when you go to gym, people look sort of from the corner of their eye, right? And he was missing a testicle. So I was trying to talk to him about body image and how do you talk about it? Who do you talk about? I wasn't talking to him about sex. And I realized this is an important thing. It comes up in people's lives. And when we don't bring it up as nurses or physicians, then patients think it's not okay to talk about. So I really, really thank you for allowing me to come today. And thank you, Virginia, for allowing me to be here. Okay. So, sexuality. When I went to get my doctorate in sexuality, Dr. Tony Ayers told me sex is more than just this. It's this too. She said intercourse is less than 10% of sexuality. 90% of sexuality is who we feel about ourselves as a man or as a woman. It's about how we dress, how we sit, how we talk with others, and how we interact with others. So I think it's important to know about what things affect sexuality and who we are, how we feel about ourselves. What are questions that we can ask our nurse or our physician about? And I'm going to give you some samples of questions that you can ask for your homework assignment. What keeps us from discussing sexuality? I think it's myths. Myths that you've heard, that society has, that your healthcare professional has. You've already picked partner A and B, but your partner may have left because of the optional part of this. So I want you to pick a new partner to talk to. You may have to turn around, or you can talk to Felicia over there in the corner. Pick a partner, and I want you to think about what are myths that you've heard about for sex and aging. Go ahead and start. You. Okay, who wants to tell me some myths? I just heard one that I had never heard of before. I love it. And I have my doctorate in sexuality. So, anybody want to share a myth? He said he had heard if you start to have sex too young, you'll lose it earlier in your life. Oh my God. So I need to tell you, in utero, when they do ultrasounds of babies, a little boy's penis becomes erect every 90 minutes. Does that mean they're ready to have sex? No. But it's a sexual subsystem, and it's starting to work, right? And the little girls, after they're born, because you can't check this out in utero, but after they're born, their vagina starts to lubricate about every 90 minutes. Interesting, huh? Okay, tell me some more myths. Maybe I'm going to learn a couple new ones. I love it. Hear that? Okay. So she said, the old myth was that if you went to a nursing home, nobody had sex. The new myth is, if you go to a nursing home now, everybody has sex. So I said, I'm going. So there are lots of myths out there. And many times people think as you get older, you're saying aloha to sex, and that doesn't mean hello. His equipment doesn't work. Her equipment doesn't work. You can't fire up an old engine. An aging body is not sexy, and sex belongs to the Pepsi generation. You know, where you have perky boobs and no cellulite and, right? No bad breath, all those good things, sure. So this morning, we're going to look at the facts. And what are they compared to the myths that we've heard about for so long? So what do we know about aging and sex? We know that sex is an important part of a full and enjoyable life. And remember, sex is 90% of this. How I feel about myself, how I dress, how I interact with other people. They did a study, and they found that in the United States, men between the ages of 75 and 80, 40% of them were still sexually active, which meant they had some kind of sexual interaction with a partner or with themselves at least once a week. Women reported less sexual activity, and usually it was because their partner was too sick or that they were widowed or living alone. You did a quiz before you came to class today. I'm not going to ask you to see the answers. I'm not going to grade you. But I want to do a couple questions with you as a group. Unfortunately, I went ahead and gave you the answers, so you probably already know it. But of question number 1, sexuality is recognized as a factor in the care of older adults. Is it A, the need to touch or be touched is decreased? B, a decrease in your libido happens? C, any expression of sexuality should be discouraged? D, all older adults, whether healthy or frail, need to express sexual feelings. All of you who vote for A, B, C, and D. This should be 100% because you have the answer. I don't know what I was thinking. Gosh, I can't believe it. So the need to touch or to be touched does not decrease. And I love it that Felicia gave the example that I usually do when I teach. So thank you, Felicia. And that is, how do you give yourself a hug? So what I would like you to do now is to practice one of those 3 approaches that Felicia told you about for touch. Good. So it's either hug yourself, hold your heart, or hold your face. Yeah? That's important. It doesn't mean that you have to have a partner. Very good. And question number 2, you already know the answer, and I know you'll get 100%. But it really is important to remember the need to touch and be touched does not decrease. You need that to live healthy. So let's talk about aging and changes in sexuality. We know that aging is out of your control. How you handle it, though, is in your hands. I tell people who come in with a diagnosis of cancer that I don't think any of them choose to have a diagnosis of cancer. But what I know as an oncology nurse is that you can still choose how you're going to deal with it. And I think that's true for anything that you're going through. We don't always choose these things, but we can choose how we're going to handle it and how we're going to deal with it. So what affects sexuality? He says, whatever happened to our sexual relations? And she says, I don't know. I don't think we even got a Christmas card from him this year. So we know that there's multiple things that affect sexual functioning. Age is one of them, medications, diagnoses for different illnesses, and partner availability. All of those can make a difference and can affect it. There are multiple things that happen, and these are just a few of that 90% of things that have to do with sexuality. I'm going to go over the sexual response cycle. In the first slide, I've put facts for you, but I really want to use this time so we can talk back and forth and answer questions. So they're there for a reference for you. I'll focus on one or two key points that might be of interest for each excitement phase, right? So the first one is for males, for excitement. Erections can take longer to happen. You may need more intense stimulation. In other words, even though I buy a sexy negligee and I come out and show my stuff to my husband, he may not have his erection come to attention like it used to. That doesn't mean that just because my boobs are sagging and I have cellulite, that he doesn't think I'm hot, right? It may, but we're going to pretend it doesn't. But it does mean that he's older. He's 72 years old. Just visual stimuli isn't enough. He's going to need physical stimuli, and it's going to take longer for him to get an erection. That's an important thing to know, because many times we think we know what that other person is thinking or wanting. We assume a lot of things. You know, we've been married for almost 50 years, and I think I know everything, and I'm always wrong, it seems like. And that's true if I look at the angle of the dangle to decide how hot I'm looking that day, right? Is everybody okay with my talking? I need to tell you, I took off my glasses so that I wouldn't be scared up here. But it also means I can't see your faces. So if I offend you, I need you to start vomiting, turn green, or have a seizure. Sorry. Okay, so what about women? So for women, remember, the way you get an erection or the way you get vaginal lubrication is vasocongestion. It's blood flowing to that part of your body. As women age, there can be less vaginal lubrication. And if you think, I don't want to use KY jelly or Vaseline or any of these other things, because if I really loved him, I would get excited and I would lubricate enough, then you're at greater risk for getting urinary tract infections. You're at greater risk for getting little tiny tears in your vagina. And speaking of Vaseline, very bad idea. It is thick, and you already have decreased lubrication in your vagina. So you put Vaseline up there, it's going to stay there, and it's going to attract bacteria, and you're going to have increased infection. So what can you use? Well, you can go to the sex stores, but Long's has wonderful lubricants that you can use also, that you can think about. Many people, especially nurses and doctors, we all think KY jelly is the way to go because it's sterile. Number one, his penis is not sterile, and he does not put it in the sterilizer before he puts it inside of you. I can tell you, I can swear to this. Your vagina is not sterile. You do not need sterile lubricant to have sex. If you don't want to keep a lubricant up by the bedside because you don't want your kids to come in and find out, oh my God, they're still doing it, Because most of us think parents only did it however many kids there are in the family, right? True story. So what you can do is light vegetable oil. You can get some light vegetable oil. It's edible, it's cheap, it's light enough to wash out of your vagina, but don't take the whole bottle up. I'm trying to give you practical information here. So, if you take the whole bottle up, I say it isn't so great. I don't wear my glasses to bed, right? I could knock it over, and then we're going to fall out of bed with all the oil. And when you go to the emergency room, oh dear God, you could be in the operating room and you'll find out about the old lady that fell out of bed. Sorry. We don't tell your names because of HIPAA, but we do know you fell out of bed because of sex. So what I tell people to do is put it in a squeezy bottle. I am being serious about this. Light vegetable oil is a great thing to use. It's easy to use. So anything that's very light oil or that is water soluble or glycerin based are safe things to think about. That also brings up, you don't want to use an oil-based thing if you are a single person and you're having sex with more than one partner or with a partner where you have in a long-term relationship. STDs, which is the new term for venereal disease, we don't say VD anymore. If you people our age, we are the highest growing group of people with STDs because we think it can't happen to us. Because the person I'm having sex with is the guy I go to church with, and therefore he would not have it, right? You can't tell by looking at somebody if they have STDs. We used to think it was just the slimy dirt bags. Guess what? It's the little old grandma or grandpa next door to you. So it's important that if you are having sex, you don't want to have unprotected sex. And if you've got a dry vagina, you want to be using a water-based lubricant. Okay. Everybody got very still. Did I offend you? Sorry. Okay, good. All right. Plateau phase. This is the next phase. And this is where you have increase in muscle tension. This is where your heart rate goes up, your blood pressure goes up, your breathing changes. And the important thing you want to know is the clitoris becomes very sensitive in this phase. And what is supposed to happen is the clitoris is supposed to retract under the clitoral hood. Remember that when I talk about women in a minute. So for men, what can happen in the plateau phase? One, their erections may not be as hard as it used to be. It may be less firm. They may not have complete erection until the end of the plateau phase instead of at the beginning like they used to. Their testicles may not rise up out of the way that they did before. Why is that important? Because if they stay down and they try to have intercourse, they could be banging, and that could cause him discomfort, nausea, vomiting. Great. Has nothing to do with your low boobs. So, what about female sexual response cycle and your plateau? Remember I talked about the clitoris and that it's supposed to retract under the hood and it becomes more sensitive? So we women need more stimulation as we get older. But many times men seem to think the only things that are important sexually is that clitoris and our nipples. You know what? My whole body is a sex organ. It's not just 3 inches of my body, here, here, and here. So if you go right to the clitoris, what can happen is you can start to have a lot of pain when you try to make love with your partner. And that can hurt their feelings if you try to talk about it, if you haven't talked about sex before. They're going to think, what's wrong? We've always done it this way for the past 72 years. What changed it on February 2018 that this now causes pain? What about orgasm? So these are involuntary contractions that happen, and they can happen even in your feet. Yeah? So what happens when we get older? As we get older, for men, they may have less contractions in their penis when they have an orgasm. when they ejaculate, there may not be as much pressure. So for you women, do you know that when they are boys and teenagers, sometimes they masturbate and see how far they can squirt? Is this a surprise to you? It is? Really? Yeah. So it sort of says something about their manhood, I guess. I don't know. I haven't gotten it. But when they get older and they ejaculate, it is much shorter. And it doesn't feel as forceful, so orgasm may not feel the same as it used to. And they may say, oh, I need to figure this out. So they may try to self-stimulate or masturbate, and they will notice it changes even when they masturbate. That can be scary if they don't know why it's happening. And if they're not comfortable talking to their nurse or doctor about it, then they just worry about what's going on. Also, the volume of semen can also decrease. So for women, we also can have fewer muscle contractions. Often we have contractions in our vagina, but often we have them in our uterus if we haven't had a hysterectomy. What can happen for us? So for me, I had an orgasm. I won't tell you when, but when I had this orgasm, I had a horrible cramp in my uterus that lasted, it felt like hours. It was probably 45 seconds, but it's really tight and it can be very painful and very scary. So you may find, if you're the male partner, that your partner, your female partner may want to have sex with you, but they really don't want to have orgasm because it causes pain. That's an important thing to know about. What about resolution phase? So this is when your body sort of returns, your testicles go down, your uterus comes down a little bit, because when you're getting excited as a woman, your uterus pulls up, your clitoris goes under the hood. For resolution phase, it comes back down to where it was originally. It can return much faster than it used to after you've had an orgasm, but the refractory period lasts much longer. This can also happen with women. So I talked about refractory period. Let's talk about that. Refractory period's an important thing to know about because it can take, so when you're younger and a male, you might be able to have an orgasm and 15 minutes be ready to have sex again. You're able to get an erection and be able to make love. As you get older, it may take you several days or even a week before you're able to get excited enough and an erection firm enough so that you can make love again. Why is that important? It's important because as a nurse, I have had women come into the GYN clinic with frequent urinary tract infections or with tiny little bruises on their body. And I've learned to ask them about it. And I have found that for many of them, they have a husband who has had a stroke. And when you have a stroke, many times you have this need for increased closeness. If you're older, many times the only time you've really been close to somebody is if you've been making love. So the person with the stroke wants to feel close, wants to feel loved, and they want to be able to have an erection and make love with you again. And when they can't get an erection, they blame it on their partner, or they will try to force their penis into the vagina even though they don't have a firm erection. That can cause the woman to have urinary tract infections, just like when you first started having sex. You heard about honeymoon cystitis. So many times that's because when you're first starting to have sex, you're just so excited about doing this, and you're ready to go, and you want to just jump right into bed and have sex, and you don't have enough time for your vagina to lubricate. Well, when you're older, your vagina isn't lubricating very fast. And then when a penis is trying to go in there, it can be very tight. and it can increase your urinary tract infections. So, or they can get frustrated and they'll do little pinches. And the woman doesn't want to tell anybody because she may be at the era where this is my responsibility as a spouse. When he wants to make love, I need to make love with him. And so she doesn't talk to anybody about it. So it's important to know about the refractory period. So what about, we talked about physical changes. What are other things that can affect sexuality? Medications can affect it. All kinds of meds. I don't know about you, but it seems like the older I get, the more I rattle when I walk, because I am no longer taking no pills. I'm taking a handful of pills and throwing them back. It seems like I've got medicine for blood pressure, for this, for that, for my left toenail, my right toenail. Lord Almighty. Anyway, so why is it important to know about your meds? So my father-in-law, when he was in his 80s, he used to sit with his friend, Bruce, with the PDR, which is this thick book about drugs, and they would sit there and thumb through it, trying to find which high blood pressure medicine causes the least amount of damage to erections. So that they could go in and talk to the doctor about, I want to change from this med to this med. They didn't tell them why they wanted to change from it. They were figuring it out for themselves. Well, now there's the internet and people are going on, but hopefully after this talk, you're going to feel braver about going in and talking to your physician or your nurse practitioner about changes that you're having and get questions answered. So antidepressants. Antidepressants is a type of medication. It's a whole family, but it's been known to cause sexual dysfunction. We know that with prostate disease, when you have an enlarged prostate gland, it can cause problems with ejaculation and it can decrease sexual desire. If you have Parkinson's disease, when you start the anti-Parkinson medicine, it can cause you to become hypersexual. That's an important thing to know, because if you're in a relationship with someone and suddenly they become sort of hypersex, it's nice to know that it could be the medication, just like when we were talking about strokes. The other thing that people forget about under medications is also alcohol. Many people self-medicate with alcohol. So when they're grieving, like Felicia was talking about, sometimes instead of 1 glass of wine, they have 2 glasses of wine, 3 glasses of wine, because they're trying to numb themselves and not feel the pain, right? So I consider alcohol as one of those self-medications that people do. So what about illnesses, disabilities, surgery? Arthritis, so you can have joint pain. What can you do about it? Because it doesn't go away. You can take a warm bath. You need to plan your sexual activity. Maybe your arthritis is less painful in the morning, or maybe mid-afternoon, or maybe in the evening, and you sort of have to plan it. It may not be that spontaneous sex where you have sex in the kitchen on the dining room table anymore, but you sort of think about it. And maybe get in a comfortable bed where there's lots of padding, and think about your position that you're going to have. And I talked about stroke, but also with dementia, there may be this sense of wanting to have more physical contact and being close to people. I already talked about stroke. What about if you've got heart disease or a heart attack? The big thing when I was first starting in nursing and I was working on the cardiac ward, many wives would come to me concerned about, if I have sex with my husband, is he going to die in the saddle? Oh, some of you are giggling. You've heard of dying in the saddle. So if you're really old, you remember the movie Private Benjamin? And her husband, on their honeymoon, died in the saddle. And her trying to scoot out from underneath her dead husband because he had had a heart attack. So does that happen? It can happen, but there are things after you've had the heart attack that your nurse or physician can talk to you about if it's safe to have intercourse and an orgasm again. So when you're with a partner that you've been with for years, you tend to not have that problem because you already know when his left hand goes here, then his right hand's going to go here, and it's like doing the Macarena, right? You sort of, no? Maybe just Jim and I do the Macarena, but everybody has their own thing. So, but when it's a new partner, think about it. You're smelling your breath, smelling your pith, and when you get ready to go to bed, you are sucking in your stomach. You're making sure, if you're the woman, you want to be on top because you don't want to lay down and have your boobs over to the side. What, you all have perky boobs still? It's coming. Wait till you get older. So you want to be on top because then your boobs hang down and they look luscious and wonderful and very exciting versus being on the bottom. So, and many times if this is a new partner, what do you do first? You don't just hop into bed. They have to wine and dine you. Thank you very much. I'm not cheap. So they take you out for a nice dinner. You have a nice glass of wine. And then you don't want to look like you're in a rush. So you go dancing. So not only do you have, and when you eat, you don't eat cheap food like Simon. It's got, right? I'm worth it. I expected to be filet mignon, and I want sour cream and butter on there. And I want that baked potato. I want the wine. My heart is already working hard because of all that heavy meal I had. Then I got alcohol in it. And then I went dancing, and we did the Macarena on the floor. And then I go home, and I'm trying to remember to hold my stomach in, lay down on top, make sure my breath doesn't smell bad, and we're ready to, and put a little lubricant in my vagina so I don't get a UTI, right? So, of course, my pulse is higher. I am more anxious. So when they did the study in Japan, and that's where the study came from, about dying in the saddle, they were looking at men who had died while they were having intercourse. I don't know how they found this out. I haven't figured it out. But they weren't looking at how many men were having intercourse and not having a heart attack and not dying, right? But that's what got blown up in the news, and it made people very nervous about it. So if you're with your regular partner, if it's with a new partner, then you may want to think about just talking about this a little bit, if he's had a heart attack or you've had a heart attack, and talk about, maybe let's just have a light salad. Let's play Scrabble. You guys are not very good audience. I am trying so hard to help you. Okay, so let me talk about one more thing that Felicia brought up about incontinence. So a lot of us have it, including me. Thank you very much. So what do? Well, you try to go to the bathroom every time you see a bathroom. You never pass one by, right? And you definitely pee before you try to go to bed so that you don't do anything. But remember, if you've got weight that's pressing on your abdomen, it's going to make it more likely that you're going to have urinary incontinence. So again, you may want to think about positioning. The other thing you need to think about is urine. We all think that it's dirty. Urine is sterile unless you've got a urinary tract infection. My father was very upset when I was going to become a nurse because his mother had diabetes when he was growing up. And he went with his brothers and sisters and his dad and mom from doctor to doctor all over Ohio and Pennsylvania about this diabetes. My dad remembers that his mom used to have to urinate in a cup and then she would have to drink it. Because back then, they felt that with diabetes, you spilled sugar into your urine and it needed to go back into your body. So my dad feels that all of us are quacks And he just didn't ever understand why anybody would want to be one of those quacks, a doctor or a nurse. So if my grandmother could have drank urine every day because that was part of her treatment, having a little urine in the bed is not the end of the world. You're not going to get an infection. It's not a dirty thing. It's what we've sort of learned in society. When we were babies, think about what happens. People change our diapers and they go, ooh, right? So we all think that down there is dirty and ooh. And it's hard because then when you're ready to get married or have a new relationship with a partner, you're supposed to give this wonderful gift to your partner, the thing that's been ooh for years. No wonder we have sexual dysfunction, for God's sake. Okay, enough of my comments here. Okay, so what about sex in the nursing home? Somebody brought it up. When we do need to go to a nursing home or our partner needs to go to a nursing home, what about it? Well, they did a study in 2007, and they surveyed older people. They found that given the opportunity, having a partner, you are just as likely to be sexually active as when you were young, well into your 70s and 80s, but not when you went to a nursing home. I think that people in a nursing home have the same rights as anybody who's not in a nursing home. So more than 30 years ago, there was a sociologist who met with nursing home operators and talked to them about having what they call privacy rooms so that people, consenting adults, could go into them and fall asleep. When my husband goes on a business trip, I don't sleep well at night. I miss him. I mush up the pillow so I can scooch my butt into it. I would be lonely. Touch is really important to me. And if I had to go to a nursing home and Jim wasn't there with me, that would be probably the one thing that I would miss the most, is curling up with him late at night and talking to him as he snores about all the things that happen. It's how we've stayed married. But he listens to me, you know, he never interrupts. It's all good. Why are they laughing, Felicia? Okay, so there was a professor who said probably it would be better to do hand-holding, kissing, and petting. It'd go farther than a sleeping med at 10 o'clock at night to help people. Hebrew Home in Riversdale in New York was the first to create a sexual expression policy, and it has been used throughout the United States. They are very good about sending it out to people. And one of the things that they talked about is there needs to be a broader definition of whole person care. So what is that definition of whole person care? Well, we know by 2030, which is just right around the corner, nearly 20% of the population is going to be 65 or older. And we baby boomers are here. And that's going to be growing faster and faster. We grew up with fewer sexual restrictions and limits than earlier generations, and we may not be able to tolerate nursing homes that don't accommodate our sex lives. I mean, let's be real. Baby boomers brought the sexual revolution to America in the 60s. What are they going to bring to the nursing home? So I've got a couple quotes for you that talks about the Sandra Day O'Connor case. Sandra Day O'Connor case is, we use that a lot when we have a resident in a nursing home that's got Alzheimer's or dementia, and they find companionship with a new resident. And that's what happened with the Supreme Court Justice's husband, John J. O'Connor III. The spouse was forgotten. And these are quotes. The top one is from a geriatrician and the bottom is a geriatric nurse. My thinking is that a person with dementia becomes like a new person, and it's unfair to judge them by the old person. You may be denying them one of the few pleasures in life they have left. So what are the principles that we use in nursing homes? One is substituted judgment, and that's the one that we used to use all the time before. If this person were still thinking the same way they did before dementia, what would they think about having an extramarital affair? But ethicists and dementia experts say we should look at the second one, which is best interests. What's good for the person now? What about ignoring past values and beliefs? What about now? Now, when I read this years ago, I thought, gosh, as a concerned nurse, I should be concerned about this patient right now and what makes them comfortable, what helps them. And then my mom died, my dad's dementia got worse, and he went to a nursing home. It's totally different when it's your father. Even though my mother had died a year before, it was really upsetting for me and my brother and sister to have my dad talk about his new girlfriend. Were they having sex? No, they weren't having intercourse. I made sure my dad was on his antidepressant and his antihypertensive. So I knew that wasn't happening. But I did know that they were petting and they were kissing, and my dad was happy and the woman was happy. And so we needed to get over it. But it's real different to talk about it, as an expert, versus as a daughter. That was hard. But I'm glad that my brother and sister and I were able to talk about it and be supportive of my dad. And that was a good thing. So I'm an old Army nurse, and I like to tell you what I'm going to tell you, then I tell you, and then right before I end, I tell you what you're supposed to remember. So, and usually we stamp our foot, that means pay attention. So, big point, communicate, communicate, communicate. Be aware of assumptions and myths. We talked about myths, but we gave you a scrap piece of paper, and now we're going to go with assumptions. Remember how I told you that I just assume I know what my husband would want and what we're supposed to do next? So take out your piece of paper and a pencil. And I want you to close your eyes. And I want you to think of an ice cream cone, your favorite ice cream cone. And I want you to quickly draw it, real quick. After you've drawn your ice cream cone, I want you to go ahead and share with your neighbor what the ice cream cone looks like. People have sprinkles, they got cherries on top. Some people have 4 scoops, that's me. Some people, and you have to decide, are you putting the butter pecan on the bottom or are you putting the strawberry on the bottom, right? If you're going to get multi-kind. So the point is, we can't assume that just because we've been together for 70 years that we know what the other person is thinking. Communication is the key. Your most important sex organ is your brain. It really is. Because, and it's communicating with yourself and talking. So if you are single, if you don't have a partner, you may say, I don't need to know about communication. Well, guess what? There's a lot of self-talk. I'm too fat. My boobs hang down below my belly button. I will never be able to be attractive to anybody else. When I work with cancer patients and they're going through chemo, radiation, or surgery, they have a change in body image. And the American Cancer Society has a list of affirmations. So let me share with you some affirmations that you may want to trade out for I'm too fat. Okay? They are, I am still a desirable person. And with these affirmations, you just repeat them to yourself, you put them on the mirror, you keep reminding yourself, I can ask for things I need from the ones I love. I will accept the love of others and be glad. The more I love myself, the more I have to give to others. The more I love myself, the more I have to give to others. That's important. Your biggest sex organ is your skin. Masters and Johnson did a wonderful study of a patient who was paralyzed and found that they were able to learn how to have an orgasm, even though they were paralyzed from the neck down. Stimulating the earlobe could make this person, their vagina would lubricate, and they would be able to have an orgasm. So your skin is your most important, is your biggest sex organ. It's not just your nipples and your clitoris or the head of your penis. So what if your desire has gone way down? What do you do about it? Well, again, American Cancer Society has a wonderful thing called a desire diary. And in it, you keep track for 7 days every time you start to get turned on. So he comes out of the shower and you see his cute little buns and you think about going up and patting him, and then you think, no, we got to get to the grocery store. Or he comes in and he says something really sweet and you think, oh my God, it was so good to come. But the grandkids are coming. So you keep track of what you were thinking, what time of day it was, who you were with, and then what did you think about it? What stopped you from doing something about that desire? Because remember I told you the brain is the most important sex organ? And you will start to see there are trends, and you've learned how to turn yourself off. When I went for my doctorate in sexuality of cancer patients on the mainland, Jim and I were separated for 6 years. We did a lot of reading before I left about how many people get divorced. And if one's going for a doctorate and another one's staying home and you're separated, how do you stay married? What do you do? So we were able to do that. We were able to use all the information that was out there. But when I graduated and I came home and it was time for it, so when I would come home for the weekends, and once every 3 months, we would have hot sex because I would work myself up. Okay, I'm going home. I got to make sure he has the best orgasm of his life, so he never wants to have sex with anybody else. So, I checked my breath, I checked my pits. I held my stomach in, I was on top, more than you wanted to know. But when I graduated and I came home and we had sex and I started to feel turned on, I started crying because it scared me. Because for 6 years, I had been telling myself, don't get turned on. And when I would come home, I was worried about Jim having an orgasm so that he wouldn't have an affair and he would think I was the greatest thing since sliced bread. I actually used a desire diary to try to teach my brain that I was turning off every time I would start to get turned on and that it was safe to be turned on. So this is a great thing. What's the other thing? Stay healthy. And you've heard me say it over and over again, communication, communication, communication. That means communicating with each other, with yourself, and with your healthcare provider. I told you I would tell you a few questions that you can use to start the conversation when you go to see the doctor. Question 1, how can I tell if the changes in my sexual functioning are due to my age or to my new diagnosis of diabetes? Is sex counseling covered by Medicare? What if you don't feel comfortable talking with your doctor? How do you find someone else to discuss this with? Since my wife had a heart attack, I'm worried that sex may not be safe. What do you think? How do I know if it's safe or not safe? Those are some of the questions that you may want to use as part of your communication, talking with your healthcare provider. Don't be scared to ask them. Talk to them. And the heart has no wrinkles. It's time for questions and answers.
Mahalo.